Hi, everyone. And so this YouTube lecture on a very, very cold evening in December is going to focus on our second week's topic, which is ethics versus the law. And it's not so much, I put ethics versus the law. That's maybe a little too dramatic. It's really a conflict between ethical issues and the law in its place. There is a number of different things on your blackboard that I'll talk about. And you also know you have an exam this coming week due by Friday, December 30th. Information on the exam is posted in the exam section as well. So we're going to dive into the topic of abortion. But I want to start because it's a pretty heavy topic, a controversial topic. We know that, but it's unavoidable. And, I've been discussing this from an ethics perspective for years, but in the last year, it is really catapulted to the front of sort of many individuals' mindset with Supreme Court rulings and then how states are adjusting to that. But I want to start off by maybe shifting directions a little bit to talk about ethics versus the law. So I think we all know this, that the age of majority, considered 18 years old, allows individuals in this country certain rights, right? We talk about right to vote, officially maybe joining military service, although I know you can do that at a younger age, and you can do certain things at a younger age with parents' permission. You can actually consent to healthcare services. We're going to talk a little bit about consent today as well. A few other things. When you're 21 years old, you can legally purchase alcohol. And in the state of Indiana, tobacco varies by state. Now, that simply is an age built into legal parameters. What it doesn't say is this. There's a limit to, let's say, alcohol purchasing. But let's say as soon as someone is 21 and older, they can, as long as they're in areas where it's, certainly legal, whether it be a grocery store, whether it be a liquor store, whether it be a restaurant, a bar, excuse me, they can purchase this. But is it legal to, let's say, consume 24 beers in 2 hours? Well, there's nothing in the law that says one can't, as long as we are meeting a certain age requirement. There are certain things saying you can't consume 24 beers in 2 hours and then, let's say, drive a vehicle. But there's nothing illegal about this. Health-wise, of course, it might not be the best idea. And just cognitively, but if all of you on this cold night or cold nights in December, as long as you meet a certain legal requirement, would like to do this, trust me, I'm not encouraging this. It's not part of the course content. You can do it. But there seems to be a conflict between what might be the right thing to do and the legal thing to do. So right thing to do versus legal thing. And in this way, it might be a good way to start our discussion, or at least have you reflect on our discussion about the inevitability of abortion. So let me introduce you to just some facts about abortion and how do you really, after you listen to this, skim through some stuff on the Blackboard site. Some of you might know this, but Earlier this year in 2022, the Supreme Court provided a ruling making the Roe versus Wade Supreme Court ruling from 1973 unconstitutional. And thus it opened every state to essentially decide on its own in the summer and throughout the summer, and then effective September 15th, the state of Indiana enacted and passed Senate Bill number 1. This is really a summary of Senate Bill number 1. It, first of all, terminates the licensure of abortion clinics and has a number of different changes, pretty much making abortion illegal except for a few categories. When there is a serious health risk to the pregnant woman or to save the pregnant woman's life, when the fetus is diagnosed with a lethal fetal anomaly, and the pregnancy is a result of rape and incest. I'll talk about that last category just in a second. Because what it also does is, Senate Bill 1 is, so I'm just going to say, for the most part, abortion is illegal in the state of Indiana. And that is medical and surgical abortion. We distinguish between the two. Medical meaning a set of pills, and surgical abortion is a surgery. There has been a great wave historically, certainly in the last 15 years, for more medical abortions, less surgical abortions. But except in these categories that are discussed over here, it also prosecutes providers, physicians who essentially perform an abortion. When I mean prosecutes, I mean jail time. Now, this is, there really is no other medical services, where if a provider does it, enacts it, where, first of all, it used to be illegal, now it's not, there's prosecution involved. Different states have made different requirements. Right next door in the state of Illinois has actually doubled down in terms of making abortion legal. They've enshrined it in their state constitution. So one might say, well, if you can't get an abortion if you're seeking an abortion in Indiana, but you can't, you can drive to Illinois. Yes, that's correct. Depends where you are. It depends on a variety of different external factors. And of course, I think we all know that there's a time limit associated with this as well. So you can certainly read more about Senate Bill 1. In fact, as of today, there's what's put a stay on it, which means some judges in the state of Indiana have said, well, until there is some more discussion, until there's some more legal action sought out in the state of Indiana, abortion can continue. So as of today, the Senate bill is put on hold. It won't be put on hold forever, but it is on hold right now. Another document, two documents that I'd like you to read through is a terminated pregnancy report. The Indiana Department of Health every year has to really summarize a variety of information from the Department of Health through the CDC about terminated pregnancies, abortions, the rationale for them occurring, who sought abortions, where they sought it as well. And so you can read that and become familiar with it. And the last thing, that document that I'd like you to become familiar with, is the Indiana Abortion Informed Consent document. Sorry, I've got some dogs who just love to be in this YouTube video, and they might start barking. This has been updated. This document as of September 2022, updated to match Senate Bill number 1. But this is a fairly detailed informed consent document that every woman who is seeking an abortion, medical or surgical, has to receive, has to agree to, has to read through as well. It's fairly detailed as well. You can see the pictures of the progression of the fetus is also noted here. Now, let me spend a few minutes talking about informed consent, because in every healthcare process and every healthcare procedure that's done, informed consent is part of it. Informed consent comes from this principle of autonomy, which we have previously discussed. If an individual has the ability to make a choice, which is consent, as long as they're informed, which means they have the information to make those choices, they can say yes. They can also say no. That is a consent, as well. No, I'm not consenting to this. And so informed consent has to be part of every procedure. It's no different than something like abortion. Now, the rules have changed with Senate Bill number 1, which makes it somewhat gray as well. And of course, informed consent, though, is so much a natural part, because it really gives the individual patient, in this way, the choice. The choices are a little bit more constrained when it comes to abortion as well, because it is, for the most part, a voluntary thing as well, except in a few cases. Now, I'm going to just write about it over here. It is, I'll tell you, from a healthcare perspective, so we're not talking about it from a political or a faith-based perspective. It is not really a yes or no, or pro-life or pro-choice. It really tends to be, and I'm going to use this word probably a few times over the course of this winter term, messy. And you all know what the word messy means. It's not tidy. It's not just black and white. It is not simply in favor of life and in favor of abortion. And so certainly Senate Bill number 1, certainly the idea that life needs to be honored and respected, especially as we talked about the idea of respect for persons, is more than just a Judeo-Christian principle. It is universal in nature. And yet we also live in a messy world where it's not as simple as, let's say, a yes or a no. What I'm going to ask you to do is listen to, it's actually a YouTube video that was produced in June of 2022, and it involves about 10 or 12 stories. These are stories of women who had an abortion. They called in, and these were edited for length. And so these are women, I think it was mainly, well, it's not connected to Indiana necessarily, although you can see the names, the ages, and the location of where I believe they're from. They talk about their stories. And what it does is really emphasize is the messiness of this issue. You can sense it in the emotion as well, and in the different nuances of the story. And thus, this idea of, ethics versus the law is, in a sense, in this issue and in many healthcare issues, messy. We know what the law says. The law right now, let's just talk about Senate Bill 1, that except for a few cases, abortion is legal. For the past 50 years, abortion has been I'm sorry, I said abortion is illegal. For the past 50 years, abortion has been legal. And now, whether it's been available or not, that's an access issue. But we understand that it is, when I say the messiness, it might not, it certainly resolves the issue, Senate Bill number 1 and other bills, that it, it outlines abortion because of the preservation of life. But as I said, if you, I'm doing this just to look at a geographic map, if we move to the left to the state of Illinois, the question is, why has the state of Illinois then really gone the other direction, where there are certainly more abortion clinics opening, where there are also, what do you call it, mobile abortions available, which means not vans, but almost like RVs, who are meeting in women where they are. It speaks to the messiness of it. Your task here is to also provide a reflection to abortion stories, which is on your Blackboard site. Okay, folks. Thanks very much. I'm going to let you go. Stay warm this week. Let me know if you have any questions. Bye.